Hello and welcome to our presentation on pertussis, or whooping cough. This presentation for the unit Evidence-Informed Health Practice at Curtin University was made in collaboration between Jennifer Gallagher, Helen Hepburn, Jamie Raj, June So, Laura Whiteside and Joella Andiris.
Pertussis is an acute and highly contagious respiratory infection that can affect people of all ages. It is predominantly caused by the bacterium Bordetella pertussis, and the incubation period is 7 to 20 days.
Over the past 20 years, pertussis has been the most prevalent vaccine-preventable disease, despite the vaccine being introduced in the 1940s and immunization program running since the mid-1950s. The transmission of Bordetella pertussis bacterium occurs through airborne respiratory droplets, and outbreaks generally occur every 3 to 5 years.
There are 3 stages of pertussis, and each is characterized by varying symptoms. The first stage is the catarrhal phase, which appears similar to the common cold and can be identified by a runny nose, sneezing, infrequent coughing, and a mild fever.
In the second phase, known as the paroxysmal stage, symptoms include intense bouts of uncontrollable coughing and difficulty breathing. These develop into the characteristic severe whooping cough sound, as well as vomiting and exhaustion. After 3 weeks, these symptoms will gradually decrease, although the attack may persevere for up to 10 weeks.
The third stage is the convalescent phase, whereby the signs of illness slowly improve over a period of months. From 2006 to 2012, the highest notification rates of whooping cough in Australia were among infants under 6 months old and children aged 5 to 9. Young infants are at the greatest risk of various complications, the most common being secondary bacterial pneumonia, which can be life-threatening.
There are various treatments available for pertussis that are specific to each stages of the disease. During the catarrhal stage, antibiotics such as erythromycin, trimethoprim, and sulfamethoxazole can be prescribed. These antibiotics have to be taken routinely in order to eliminate the Bordetella pertussis bacterium from the nasopharynx and render the patient non-infectious. However, research has shown that erythromycin can cause negative side effects such as gastrointestinal discomfort and, in rare cases, HBS initis. As a result of this, erythromycin has been discontinued in many countries. Trimethoprim and sulfamethoxazole antibiotics are a safer option for treatment.
In the paroxysmal stage, treatment options for the relief and reduction of coughing bouts include steroids and bronchospasm medications. These treatment options are verified relievers of clinical symptoms. However, there is no evidence to support their use as effective interventions for the cough associated with pertussis.
It is important as a parent or caregiver to consider the best evidence-based approach for treatment methods, as this will indicate how reliable and valid the treatment method is. Evidence from the Cochrane database of systematic reviews concluded that trimethoprim and sulfamethoxazole are the preferred treatments for pertussis. The use of steroids and bronchospasm medication have not proven to be effective in reducing coughing bouts. Therefore, they are not recommended.
We know that this information can be trusted because systematic reviews are Level 1 evidence, making them Grade A recommendations. Level 1 evidence has the lowest chance of bias and is the most reliable scientific evidence to guide a decision for the treatment of pertussis. Level 5 evidence, such as anecdotal evidence, is a common avenue that parents and caregivers may rely on to receive information. Thank you for listening.